Hello, everyone. I'm Angela Rosa DiDonato.
And I'm Marian Leary.
And you're listening to Amplify Nursing, a Penn nursing podcast supported by the Pinola Fund for Innovation in Nursing.
Amplify Nursing features nurses who are leading the way in science, policy, and innovation.
Our guests defy stereotypes, define practice, and disrupt convention.
We highlight the breadth and depth of nursing influence on society by amplifying nurses who are pushing boundaries and breaking down barriers to build a new paradigm.
For those marginalized populations to understand that you can do this. It's hard, but it's worth it because you are needed. I also want them to understand that you are needed. We need people that look like us to be in these spaces.
In today's episode of Amplify Nursing, we speak with Dwayne Allyne. Dwayne shares his unexpected journey into nursing, the leadership lessons he developed through his clinical work and his time in the Air Force, and his role as the board chair of DNPs of color. He discusses the importance of advocacy, representation, and creating pathways for more diverse nurse leaders, while also reflecting on how his own experience as a patient has reshaped his perspectives on care. This conversation highlights the need for stronger support systems, greater equity in healthcare, and empowering nurses to lead at every level.
Dr. Alleyne, thank you so much for talking with us today. Really excited to have you on the Amplify Nursing podcast.
Great to be here. I'm looking forward to this conversation.
So first and foremost, I'd love for you to just tell us a little bit about yourself, introduce yourself to our listeners who may not know who you are and what your background is, specifically related to your position as the board chair of DNPs of color, but how you got into nursing and what led you to that role.
Okay, no problem. How I got to nursing is a funny story because I will say I never wanted to be a nurse. My mother was a nurse and she always kind of tried to convince me to be a nurse. I actually went to school to become a physician. I have a degree in physiology. I went to Michigan State University. I tried to go through the normal process of what it takes to become a physician or to get into med school. Things didn't work out. I tried multiple things and that pathway for some reason did not work out. But however, it was a blessing in disguise because it led me into the field of nursing. My first exposure to nursing is when I decided to go to school, a technical school, to become a licensed practical nurse. And I did that reluctantly at first, because as I stated earlier, I did not want to be a nurse. And I fell in love with it. Just the thought process of the complex thinking, the way I can impact patients' lives and individuals' lives truly inspired me to continue to move forward. So shortly after I worked for a little bit as a LPN, I decided to go back to school as a RN. I went to Adelphi University in New York. And after I became an RN and graduated, I decided to start my career as a registered nurse in the United States Air Force. And that's where I first got exposure in leadership in general. Because when I was in the Air Force, I got thrown into a leadership role where I was forced to be in charge of, they call it wings and flights. The wing is the bigger group, and underneath the wings are the flights. So I was the wing leader of part of some exercise programs. I had to create exercise programs and do all this stuff. So that was my first taste of leadership. And then I truly got more comfortable in leadership positions. So it translated into my role as a nurse. After I got out the Air Force, I worked as an ICU nurse. And then I went to school and became an acute care nurse practitioner. And then 10 years later, I got my doctoral degree and started really doing some leadership positions. Prior to me getting my doctoral degree, I worked with one of my classmates from my acute care nurse practitioner program, and we formed a group called Capital Nurse Practitioner Group. I was a co-founder of this organization. It's something that started small and blew up over a few years into one of the largest networking organizations in South Carolina. We were a large group of nurse practitioners in South Carolina that would create events, networking events, do conferences, educational sessions. And that was my first role as an executive leader. I was first the vice president, and I became the president, then I became the executive director, and pretty much kind of ran that organization until I had to unfortunately shut it down about a couple of years ago. During that process, while I was doing that, I met Danielle on LinkedIn. Danielle became the CEO of DNPs of Color. Met Danielle on LinkedIn, and we exchanged ideas. And that's when she pulled me on to DNPs of Color, where I first started as a board member. Then she convinced me to be a board chair. And since then, I've been enjoying seeing even a broader scope of what it means to be in the leadership space as a nurse. I've been exposed to multiple nurse leaders throughout the country and even outside of the country. So I've learned a lot so far, and I continue to learn a lot through my networking and exposure.
Yeah, Dr. McCammy's really good about pulling people into the things that
Yes.
she's working on.
Yes.
It's interesting. You should know I never wanted to be a nurse either. So I feel you where like you're trying to figure out what you want to do and people are pushing nursing and you're like, I don't know if that's a fit
Mhm.
for me or not. But boy, has it really, I think similar to you, nursing opens up so many doors and so many pathways that I don't think people, students really understand until you're in it. Such a versatile field.
Yes.
So I'd love to go back a little bit. You mentioned that you were in the Air Force and that that's where you really learned about leadership. Are there skills that you learned in the Air Force that you have brought over with you into nursing? And what does that look like?
Yes. So I always tell this story. There's a lot of skills I learned in the Air Force, and that I call it the pivotal moment of leadership when I was in the Air Force because, and I'll kind of give a brief background to kind of explain how it worked with in the Air Force because I came in as a nurse. So when you're a nurse, you come in as an officer, and the training is different from enlisted. So it's kind of, get a little bit more comfort. So we didn't go in the barracks and stuff. We had nice air conditioned rooms and exercise. We were able to write down our own exercise. It wasn't like mandatory. It was mandatory, but we didn't have to be supervised. One of the things that occurred was I was just part of the flight, and we did have to meet sometimes during the week where we all did exercise, and we had to present our exercise or we exercised together. The person who was actually a nurse, she was in charge. She had an episode, something happened, and she had to go home. So while in the middle of the exercise, while we were doing exercise, the leader pointed to me and said, "You're in charge now." That's what. So I had to pivot right there and hurry up and create something in that moment. And so that's the one thing I learned when something unexpected happens, be ready to pivot. Don't panic. Relax for a little bit. Think of your options, and then go with it. So I had to go with it, and I just created this exercise in the moment. And after that, I continued to develop some further programs. One of the things I did, and I didn't realize I was doing a good job until someone gave me some accolades. I noticed that people were just doing some regular boring exercises, and then they were bored with it. So I created like a volleyball tournament. I worked with people and developed a schematic for laying out the team. So they had volleyball tournaments. I laid out some other exercise programs, and it worked out well. They had a fun time doing it. So one of the things I learned is networking. Networking, find out who can help you. Work with that person. Be open to ideas. So pivoting, networking, being open to ideas, knowing when to seek help. So those are the qualities I learned in the Air Force that I translate now up to this day in my leadership roles.
Yeah, I mean, they're all perfect skills for nursing and for nursing leadership for sure. So, can you talk then a little bit about DMPs of color and what you all do and how you work with your members?
So DMPs of color, I love this organization, I must say, because one of the things I realize is that I can say for myself, especially as a Black male, the number of Black male DMP prepared nurses. Before I joined DMPs of color, I did not only knew one. So so I noticed that there's a deficiency in general especially with Black males or maybe those marginalized communities that would actually go forward and get their terminal degree, whether it's a doctoral or a PhD. So what this organization does is to help increase diversity in doctoral studies, and we do that by first by being present and informing people. And so by being present, they can say, hey, this person that looks like me has a doctoral degree. We also kind of showcase different things that we can do as a nurse with a doctoral degree or with a terminal degree outside of just being bedside. So many people either on the board or members they're on the committees, they're CNOs of organizations, they're entrepreneurs, there's deans. So they're at the top levels of different aspects of nursing. So we kind of showcase these people and show that this is what you can do, despite thinking that you're a part of a marginalized community, you can be in the highest level of this field. So we kind of help with that. So we increase diversity in doctoral studies. We also address marginalized communities. So we kind of work with healthcare policy. So we're part of multiple policy initiatives, healing politics. We go on the Hill Nursing Coalition. So we kind of work with politics because politics does impact nursing and it also impacts nurses of color. So we kind of work with that. We work with multiple organizations to educate our members, especially those that may be thinking about going into different fields, maintaining specialties. So we kind of go through that too. And as our biggest thing is making people comfortable and giving them a safe space. That's the big thing. That's what Daniel say, providing a safe space for marginalized nurses. So we let them know, especially at the conference. I can tell you the conference is the biggest thing where people can feel safe and to talk about things that discourage them in the workplace, like being demarginalized or being discriminated against or microaggression. So those topics that are usually taboo or we're told to keep quiet about, we have that safe space to openly and freely talk about. And I can tell you, most of the members that attend our conference feel empowered. So we do have a lot of plans. We continue to plan to do this with a more intentional, especially during these times, we tend to be more intentional with these goals and speaking out more and encouraging and supporting those who don't feel the support from where they are.
I wonder, there are a lot of nursing organizations that don't feel comfortable speaking out in the political sense right now. And is DNPs of color encouraging their members to use their voices during this current political climate?
Yes, but since this climate occurred with all the attacks on DEI and all the changes in the colleges and all this stuff coming down, we have these meetings, special sessions or meetings that we have, town halls. Yeah, so we have these town halls, and one of the first things we did when all these things came down the line, when they were really being aggressive and with these DEI things and all these schools, I can tell you, my school, all the schools start changing the name from DEI to ABC or belonging. They try to change the names, and we started seeing all these grants being pulled, and we were being told that we can't say certain words. We held a town hall and we gave opportunity for members to speak out and express their true feelings. And we kind of answered the call to some of their requests with the ones that we could. We provided encouragement. We provided some action plans. Also, one of the things that we did, I put kudos to Danielle. We formed a coalition of all nursing organizations of color to make a statement on what's going on. So there was a joint statement addressing each and everything that was going on, and it was from all the organizations of color trying to make a bold statement how we will stand against and fight against these aggressive tendencies to remove DEI or threaten DEI or threaten organizations that are deemed utilizing DEI as part of our main focus. So that's what we do, kind of open up, and we always provide, I can say with my board, every month I leave a board chair message, and one of the last one in February, I told them, the members, do not let people silence you. Speak boldly, but speak with professionalism. Do not cower in the face of pressure. Continue to look out what you need to do in order to make your voice whole. Make your voice whole. So that's what I kind of looked at.
Yeah, I think that's great. And I really wish more nursing organizations would do the same thing. I wonder, what is leadership like for you on an individual level? How have you formed your sort of ethos around leadership?
Oh, wow. I said leadership is time consuming, taxing sometimes, but when you see the results, it's worth it. So I can say I'm in multiple leadership positions, especially in that sense, if you're in academia, that's a requirement to maintain the status of many positions. So one of the things, my leadership positions throughout, I just was named the director of practice, office of practice in August at my university. I'm just as named acute care practice chair of the South Carolina Board of Nursing. I'm on the SENA. I'm also the curriculum chair of the council and then of course board chair of DNPs color. So leadership is my ethos, and I've learned from each of those spaces, and I take share my ideas amongst those organizations. I'm learning ways to make impact because my biggest goal as a leader is to make impact. Second goal is to be fair and then encourage others because that's my biggest thing. I don't want to get my head blown up because I'm a leader and say, "Hey, look at me. You need to just focus on me." I focus on those that have potential. And I recognize those and kind of bring them up to where I'm at and possibly push them further than me. So I try to recruit, encourage people. So we need people like you. We need, especially if they have certain qualities. I notice. I said, people need you. You need to be at the forefront. Stop hiding yourself from the world, put yourself and expose yourself to others. So as part of my leadership issues, our big thing is I look for impact, inspiration, encouragement, and uplifting others who may be scared to enter this leadership realm as a nurse.
We were talking before we started recording that you had an experience within the healthcare system that has really helped to change the way that you now interact with systems and people within it. Can you share a little bit about that experience and how that has changed for you?
Yes, sure. So one of the things people that follow me may understand because I openly share it, so I don't mind. So I was diagnosed with prostate cancer in May 10th. I elected to have my prostate removed on December 3rd. The procedure went well, but unfortunately, I underwent a complication where I developed peritonitis because the site that was cut was leaking into my abdomen. So I ended up developing peritonitis, ended up in the hospital for 5 days post-op. So I was fine for 7 days, and post-operatively, I went back into the hospital and ended up staying for 5 days, unfortunately, because I consequently developed the ileus on top of that peritonitis. But one of the things I noticed is I had to advocate for myself. Even before I got diagnosed with prostate cancer, I had to advocate for myself because one of the things that occurred was my urologist I originally saw was no longer available. So they was just telling patients you need to go somewhere else. Fortunately, I had a good networking and connection with one of my nephrology colleagues, and they got me in touch with my current urologist who expedited the process of me getting diagnosed and treatment. So one of the things I had to do is advocate and realizing how patients don't have the medical knowledge so they can advocate for themselves. So you cannot assume they don't know or they just have they're apathetic. You can't assume that because they may not have the medical knowledge and they don't have those that can advocate for themselves. So that's one of the things I kind of look at. So this before I think, hey, this patient is just oblivious, I say, hey, this patient may not know exactly what's going on. They may not have those that can advocate for them. They may not be able to pick up certain things. So I have to try to be that advocate for that patient and truly assess where is their knowledge base? What do they know? I can tell you my experience in the hospital is very significant as well as starting from the ER visit. I can tell you that my provider was about to send me home from the ER. And I'll kind of tell you the story briefly. I had my catheter removed. About 30 minutes later, I developed severe pain to the point where I fell on the floor. I couldn't get up. But I had to force myself into my truck, get taken to the ER, was given lots of pain medicine. It did not touch me. The provider came in the room and asked me, "Do you know? Did your surgeon tell you you're going to have pain?" And so that truly I was truly flabbergasted at that time that the provider would ask me that. And I told them, well, not like this. And they told me, well, we gave you all the pain medicine. The X-ray looks, CT scan looks good. You probably, so we don't know what else to do. So I told the nurse, since I was a nurse practitioner, I said, let me look at that CT scan. I read the CT scan and it clearly indicated what I had, peritonitis, and it showed the leak. It showed a bunch of other things that indicated that I was not okay to go home. So fortunately, I was able to text my nephrologist, who texted my urologist, who got me transported to another hospital. So that's the new thing I kind of learned about. Pay attention to the patient. Make sure you focus on truly what's going on and informing the patient. And during my 5-day hospital stay, one of the things I was noticing is that some of the I was waiting for the provider. I was kind of waiting, like, okay, what's next? What's next? And some of them literally spent less than a minute with me. So I was kind of, disappointed, and I noticed those that actually spent time and talked to me for a while. So I understood how my presence was important, and making sure before I leave, don't look rushed. Make sure I stand there and make sure they don't have any questions and they're at ease with the information I gave them.
Yeah, I mean, your story, and I'm sorry you experienced all of that, it is so similar to what a lot of people experience in hospitals and health systems these days, with providers who are so overburdened and are rushing from patient to patient, and
Mhm.
things get missed. And I guess, you know, my question is, as a DNP, as a nurse leader, how do we fix the system? I recently had a loved one who was in the hospital, in and out many times over many months. And if it wasn't for our family staying on top of things and advocating, I don't know what would have happened. At one point, they had severe respiratory distress because of an error caused by the institution she was at. And it was only because a family member actually picked up what was going on did that get resolved. Like, not everybody has the background as a healthcare provider or family to be there and advocate with them. They shouldn't need that in a health system. So, like, but that's where we're at today. So, how do we, I don't like, how do we fix a broken system is a big question, but like, what can we do as health system nurse leaders to advocate for a better system for patients who don't have advocates?
And I think that's a very challenging thing. I can do my part from the academia, kind of teach the students, but I don't get to touch the students at every level. Like I touch the undergrad students early. So I don't see them afterward. But I do teach acute care. I kind of added some things to my lesson about discharge planning, things to look for. And then, there's a lot of the book I use is very didactic, just straightforward. So I kind of add my own flair. Okay, you may have this, but this says this, but you do have to look for this. And this way you have to tell the patient. So I talk about communication strategies in general. From the hospital system standpoint, as a leader, I think we have to get involved and talk to those that impact the system, whether it's be the nurse leaders, physician leaders, case managers, whoever, kind of have that conversation and say, hey, this system is broken. We need to find ways to have conversations with these patients and make sure we advocate for those who have low level knowledge about the disease states. Because I had low level knowledge about prostate cancer, even though I learned that I can tell you pretty much everything about every disease system. I had minimal knowledge about prostate cancer. I knew what I'd like to be a beginner. I was clueless. When I had prostate cancer, I thought I was going to die until I learned from other people who had it. Okay, this is not that as bad as it seems. This is what this means. This is that means. So I can imagine people with other diagnoses having no clue what's going on, and they're completely dependent on those that provide for them and not knowing exactly what this means. Because one of the things with prostate cancer is people get blown off. I had a friend of mine that got blown off, and it was told it was maybe an infection, and I insisted, no, go get your biopsy, and it turns out they did have cancer. So things are being done, and that these patients that don't have the knowledge and not pushing for certain things are getting blown off Because one of the things I noticed when I work in the hospital, I noticed a lot of, especially African American males, they have the later stages of cancer where they're getting radiation and chemotherapy because it's in the bones. And then they probably could have been prevented if they knew about it and was aggressive earlier, but they wouldn't know because you don't know what you know. So kind of find out ways to incorporate advocacy through all levels, whether it's the nursing, physician, case management, general management, CEOs. So that's probably a way to do it. And it's very difficult because you have to show up in these spaces or train other people to kind of show up and advocate for these patients.
Yeah, and I guess that goes back to what you were talking about, DNPs of color. You all encourage your membership to advocate in all different levels. And so hopefully that is sort of part of this bigger push as well. So
Yes.
where do you see DNPs of color transforming either the profession of nursing or healthcare in the future?
Well, I see us, one thing is building the percentage of people that obtain their doctoral degrees. And from my standpoint as the board chair, I would like to see more people have the confidence to go forward with their doctoral degree. I'm not the type to say you are nothing without your doctoral degree. If some people are not interested, that's fine, but I do. Or if they're not interested in getting a PhD, that's fine. But my target is those people that feel like they're not worthy or capable of getting to this level of obtaining their doctoral degree. So that's one thing, and especially among the men, because I did a non-formal survey, and I asked, how come I don't see much men with a doctoral degree? And some of the general consensus was, or it's not worth it, or I'm not worthy of it, or I cannot do it. So I want to kind of get rid of this lack of confidence in general for those marginalized populations to understand that you can do this. It's hard, but it's worth it because you are needed. I also want them to understand that you are needed. We need people that look like us to be in these spaces because we always use that table. We always use this phrase that if you want to, you don't worry about getting a seat at the table. You have to end up being the table sometimes. So if you don't can't get through the door, you just form your own and get things going. So kind of advocate for leadership structure and take them through the reins and learn the different aspects of what it takes to be a leader and to make impact. So I think I see DMPs of color doing that because we already have a big strategy and plan to make further impact. We plan to reach different areas of the country with our mission, our goals, plan to implement programming, organization programs, and other things to help reach and develop future nurses and those who are already nurses to reach the highest pinnacle of their educational journey.
If folks want to join DMPs of color or get more involved, learn more, where can they get more information?
So they can go to dnpsofcolor.org. So DNPs of color is one word and .org. Or they can email me, my first name, Dwayne at dnpsofcolor.org. Or people can find me on LinkedIn. I guarantee you, if you want to find me, look for me on LinkedIn. You can, because I already get a lot of emails, people asking me or direct messages. So find me on LinkedIn. I'm always there. It's easy to find me, Dwayne Allyne. And I'll be happy to talk to you or give you more information. But dnpsofcolor.org gives you all the information on about our mission, our events. And once you join, you actually become part of a platform that keeps you updated. Our platform has community. So we have a new member community and it keeps you up to date with all the events that's coming up. We have a town hall coming up towards the end of March, I believe March 26th. We have an event coming up on the 19th of this month. So all the events are listed on our website and this platform once you become a member. And you can join these communities and talk and develop mentors, get mentors for certain things. So there's a lot of benefits to being a member because you have access to a lot, especially as that will help grow your potential as a nurse or a nurse leader.
Well, Dwayne, thank you so much for taking the time to talk with us, share your story, and really appreciate the work that you're doing with DNPs of color and pushing the profession in general to speak out and advocate as well. So thank you so much.
Thank you. Thank you for having me.
Amplify Nursing is hosted by Dr. Angela Rosa DiDonato and Marion Leary and produced by the University of Pennsylvania School of Nursing. Music for the podcast was created by Harper Leary. The podcast is made possible by the Krista and Rich Pinola Fund for Innovation in Nursing.
Follow us on Twitter at Penn Nursing. Until next time, keep pushing over, under, around, and through.